February 2nd is National Wear Red Day, which is why we are. The American Heart Association encourages women to wear red to highlight the importance of raising awareness about women's heart health.
It's so important. Today, we are here with two women of impact, Robin and Savannah, and they're here to shine a spotlight on the number one killer of women. This is heavy, but we're also providing hope, so welcome in, ladies.
Yes, thank you both for being here. Robin, let's start with you. Sure. What is your personal connection to the heart?
Yes, so unfortunately, I lost my father-in-law, a little bit less than a year that my husband and I got married. And that's really what has drove my passion for American Heart Association. I started with the walks, and now I've gotten engaged and I'm involved with women's affinity groups. And so with this cause of Women of Impact, I really want to advocate for women and bring that forward. So that's my why.
Wow, I'm so sorry.
Thank you.
Yes, but you're driving force for change, and that's exactly what the American Heart Association is on. They are on a mission. So why Wear Red Day? What does it mean?
Wear Red Day is so special. This is the kickoff of our 9-week campaign. Women across the country are stepping up for the American Heart Association starting today, and we wear red to advocate for our communities, advocate for women's heart health, because cardiovascular disease is the #1 killer of women in the United States.
Wow, that's so unbelievable. But I'm so glad that you're bringing such awareness to this. Now let's talk about the Women of Impact campaign. What is the goal behind that campaign exactly?
So the goal behind the Women of Impact is really about driving the awareness, but also about the fundraising that we do for American Heart Association. They bring such great things like research, and also STEM Goes Red. There's so many different elements of Go Red for Women that brings this to the forefront so that women know that this is, like you said, #1 killer of women. We have to pay attention to it.
Well, that's what I was going to ask. Are there any warning signs that we should be aware of when it comes to our heart health, since this is the #1 killer of women?
Yes. Go ahead, Savannah.
Well, I am a volunteer firefighter and emergency medical responder, so this is very close to my heart, and women present so differently in cardiac events than men. We need to recognize that when we feel something is wrong, it's time to advocate for ourselves, and it's time to go to the doctor and get checked out. You can recognize high blood pressure, hypertension, any kind of abnormal feeling in your chest, pain that radiates into your left arm could be indicative of a cardiac event.
Now, I know they talk a lot about numbness for men in the left arm, but is that the same? I know you just mentioned pain.
Yes, so women present very differently, and that's why we say that anytime you feel something's wrong, even if it is neck pain, pain in your back, your shoulders, tingling, you could be having a cardiac event. So you should definitely go get checked out if you feel anything abnormal in your chest.
And I know that what's the #1 life-saving tip? We were talking about this before the show, but for everyone else out there, life-saving tip.
Yes, so for me, it's all about making sure that if someone goes down, I just did CPR with some warehouse workers with my company, so you want to make sure in a safe space, if somebody goes down, you want to make sure that you call 911 because they don't have much time. And I know with Savannah, in her line of work, you have to really make decisions very quickly, and with CPR is one great tool, hands-only CPR, to keep going and make sure that you can get somebody there.
Very good.
Thank you so much.
Thank
you
you
both. Read more about the American Heart Association programs. Visit them on the web at www.2.heart.org.